This video is intended to teach therapists how to construct maggot therapy dressings to treat non-healing wounds. It was produced by the Biotherapeutics Education and Research Foundation. Maggot therapy is the use of specially selected and processed fly larvae as a dressing for non-healing wounds. The procedure can be done in the hospital, the outpatient setting, or even at home or in the nursing home. In the United States, maggot therapy must be prescribed by a licensed physician, but it may be applied by the doctor, nurse, physical therapist, or even by the patient or the patient's family. While no specific certification is required to apply or change the dressings, the most successful therapists are those with experience and knowledge about the process. Special pre-assembled dressings can hold the maggots in place, but currently most therapists make their own cage-like dressings out of readily available materials. This film will help those therapists construct simple yet effective maggot therapy dressings. The basic dressing must prevent the maggots from escaping, permit air to reach the maggots, and permit the efflux of wound drainage. Ideally, the dressing should also be inexpensive, comfortable, and should protect the skin. The following multi-layer design has been found to be quite successful. A skin-protecting liquid or pad is placed on the healthy skin surrounding the wound. This will be the foundation upon which the adhesives will be mounted. The medicinal maggots are placed within the wound bed, along with gauze for them to crawl on. The maggots are covered with a porous mesh or netting, which is glued and or taped to the supporting foundation. It is often valuable to add additional layers of tape or transparent membranes to secure the dressing and prevent the wound drainage from dissolving the adhesives. Cover the cage-like dressing with some loose gauze to absorb the drainage that will result as the maggots dissolve away the necrotic tissue. Replace only the top gauze layer every 4 to 8 hours as it becomes soiled. Remember never to cover the porous netting with any layer that would obstruct the inflow of air or the outflow of fluids. Remember also to read the labeling and packaging literature thoroughly for instructions, indications, and warnings. Now, let's see how to construct the dressing in real time. We will assume that you have selected and prepared your patient appropriately. We recommend that prospective patients be properly educated about maggot therapy and then give written, informed consent. Be sure to have all of the necessary supplies readily available at the bedside or work area. These will include your sterile porous dressing, such as a polyester chiffon, netting, or nylon stocking, and your medical-grade maggots. You will need skin cleansers, protectants, hydrocolloid pad, and something with which to cut the dressings, such as a scalpel or scissors. You will also need adhesive tape, glue, and gauze. Clean the wound and the peripheral skin. A liquid skin protectant is a good idea to prevent the voluminous wound drainage from irritating the healthy skin. This drainage is filled with liquefied necrotic tissue, bacteria, and the maggot's strong digestive enzymes. From your hydrocolloid pad, cut a hole which precisely matches the wound. By having this pad extend all the way to the wound margins, you will not only protect the surrounding skin from wound drainage, but also prevent the maggots from straying onto normal, sensory intact skin. Once the hole has been cut from the hydrocolloid or protective pad, place the pad securely on the peripheral skin. You want to have a seamless border around the wound so that the maggots do not crawl out before you are ready to remove them. At this point, you could simply place the maggots in the wound and tape the netting over them. But I like the added strength of a liquid adhesive with which to bond above and below the netting and through the netting pores. Most fast-setting liquid or spray medical adhesives work well. If none are readily available, contact cement from the local hardware store also works well. You want to use adhesives which are not dissolved by the maggot's proteolytic secretions. A list of recommended adhesives and dressing materials is available from the Better Foundation. Now it is time to add the maggots. You should have inspected the maggots when they arrived, because they are highly perishable and occasionally die during transport if environmental conditions cannot be controlled adequately. Now inspect them one last time. Get them down from the lid by banging the vial on the counter 3 or 4 times. If you want to see them better, or get them to crawl up the sides of the vial, then warm them up in your hands by rubbing the vial back and forth. Put on your sterile gloves before opening the vial. The recommended dose of maggots is 5 to 10 per square centimeter of wound surface area. Applying maggot dressings for the first time is best done with an assistant, but if you don't have an assistant, you can open the vial without contaminating your sterile gloves if you cover the surface of the vial with a sterile gauze pad. If you need only a dozen or 2 maggots, then you can take them easily from the sides of the vial. Grab a wet 2 by 2 inch gauze pad, hold it between your second and third fingers, and wipe the inner wall of the vial. You can see the maggots through the vial and count them roughly as you wipe them up. Surface tension will cause the maggots to adhere to the wet pad, and they will not be harmed or crushed as they would by a dry pad or cotton swab. The maggots are much too small to count precisely, so just estimate the amount you pick up. You will never be able to get a precise count of maggots going into the wound, and you should never count or expect to retrieve a specific number of maggots as you remove them from the wound 2 or 3 days later. If you need many maggots, then remove the entire gauze pad from the vial. That is where most of the maggots are residing. If the size of the wound calls for roughly half the number of maggots in the vial, then use only half the gauze pad. The gauze in the vial is intended to make the transfer of all the maggots nearly effortless. Add additional gauze to loosely fill the wound space. This will provide the maggots with additional surface area upon which to crawl and take some peaceful breaks between meals. Now cover the wound with the porous netting, making sure not to allow any wrinkles. To the maggots, a wrinkle in the dressing is an escape tunnel. Add another layer of glue and top this with a layer of silk, cloth, or pink tape over the portion of the dressing that is mounted to the foundation. I prefer to avoid placing tapes and adhesives on normal skin. Often, even the healthy skin in a chronic wound patient can be traumatized easily. Therefore, I always trim the excess tape that hangs over the colloid foundation. Again, remember never to cover the center of the porous netting with anything that would obstruct the inflow of air or the outflow of fluids, for otherwise the maggots will suffocate or drown. When I expect that there may be a lot of drainage or that the dressing may loosen from excessive motion, then I cover the tape layer with a transparent membrane dressing. This will keep the drainage from contacting and dissolving the tapes and adhesives underneath. I also cover about 1 centimeter of healthy skin that extends beyond the hydrocolloid pad with this same dressing. Any maggots which manage to escape from underneath a loosened hydrocolloid pad will be arrested by the transparent membrane. Once the cage dressing has been completed, you can add a light, loose layer of absorbent gauze on top. This layer should be light enough that air can reach the cage underneath, even if the absorbent gauze is soiled. Of course, the gauze should not be allowed to remain soiled for long, for otherwise the maggots could suffocate or drown if the wet outer gauze is not changed every 4 to 8 hours and whenever soiled.